Chlamydia is a common sexually transmitted infection (STI) caused by the bacterium Chlamydia trachomatis. It can infect both men and women and often presents without noticeable symptoms, which makes regular screening important for sexually active individuals. If left untreated, chlamydia can lead to serious health complications, particularly in women, such as infertility. Causes: chlamydia is primarily spread through sexual contact with an infected person. The infection can be transmitted during vaginal, anal, or oral sex. It can also be passed from a mother to her baby during childbirth, leading to eye infections or pneumonia in the newborn. Symptoms: chlamydia is often called a silent infection because most people do not experience noticeable symptoms. However, when symptoms do occur, they can vary depending on the site of the infection. In women, vaginal discharge, unusual discharge that may be yellow or have an unusual odor. Painful urination, a burning sensation when urinating. Lower abdominal pain, discomfort or pain in the lower abdomen. Painful intercourse, pain during sexual activity. Bleeding, between menstrual periods or after sex. Rectal symptoms, if the infection is in the rectum, there may be pain, discharge, or bleeding. In men, discharge from the penis, a clear or cloudy discharge. Painful urination, a burning sensation when urinating. Testicular pain, pain and swelling in one or both testicles, though this is less common. Rectal symptoms, if the infection is in the rectum, there may be pain, discharge, or bleeding. Complications: if left untreated, chlamydia can lead to serious health problems. In women, pelvic inflammatory disease (PID), a serious infection of the reproductive organs that can cause chronic pelvic pain, ectopic pregnancy, and infertility. Increased risk of HIV. Chlamydia can increase susceptibility to contracting HIV if exposed. Complications during pregnancy. Infected pregnant women can pass the infection to their baby, leading to eye infections or pneumonia in the newborn. In men, epididymitis, inflammation of the epididymis, causing pain, fever, and in rare cases, infertility. Prostatitis, inflammation of the prostate gland, which can cause pain during urination or ejaculation. Both men and women. Reactive arthritis, a condition that can develop in response to chlamydia, causing joint pain, eye inflammation, and urinary issues. Diagnosis: urine test. A urine sample can be tested for the presence of Chlamydia trachomatis bacteria. Swab test. The swab may be taken from the cervix in women, the urethra in men, or the rectum or throat if these areas are potentially infected. Treatment: chlamydia is easily treated with antibiotics. The most commonly prescribed antibiotics are azithromycin, usually given as a single, large dose. Doxycycline, taken as a course over 7 days. Both partners should be treated simultaneously to prevent reinfection. It's important to abstain from sexual activity for 7 days after starting treatment and until all sexual partners have been treated to prevent reinfection. Prevention: regular screening, regular testing is essential, especially for sexually active individuals under 25, pregnant women, and those with new or multiple partners. Use of condoms. Consistent and correct use of condoms during vaginal, anal, and oral sex can significantly reduce the risk of transmission. Limiting number of sexual partners. Reducing the number of sexual partners can lower the risk of contracting STIs. Communication with partners. Open discussions with sexual partners about STI testing and sexual health are crucial. When to seek medical attention if you experience any symptoms of chlamydia, such as unusual discharge, pain during urination, or pelvic pain. If you have had unprotected sex with a partner who may have been exposed to chlamydia or other STIs. If you are diagnosed with chlamydia, it is important to notify all recent sexual partners so they can be tested and treated. Follow-up test if cured. In some cases, a follow-up test may be recommended after treatment to ensure the infection is fully cleared, particularly in pregnant women or when symptoms persist. Retesting. It's recommended to get retested about 3 months after treatment to ensure there's no reinfection, especially since reinfection is common. Chlamydia is a common but preventable and treatable STI. Regular screening, safe sexual practices, and early treatment are key to preventing the spread and complications associated with chlamydia.